Today's press conference is about men's health, men's awareness, and sometimes lack of awareness and lack of paying attention to small details and actually doing what we're supposed to do when the insurance companies tells you this is what you have to do. So again, thank you for joining us in our initiative to help with the men's health right here in our state.
Because many men feel they should be able to deal with these things on their own, they may not reach out to others and realize that they're not alone. And really, none of us wants to suffer alone. None of us should worry alone in life. And when men are trying to face their own health issues, first, I think one of the things that's been brought up here is some have commented particularly about how they had no symptoms. Well, how is prostate cancer screened for? There is a blood test called a PSA, and it has its strengths and weaknesses. Sometimes it can be a little bit up, and it's a false positive. There are times it could be a false negative. And really what you want to do, though, is talk with your doctor. Go in for that yearly visit to be able to determine, should you really get a PSA? And is the doctor going to be able to help advise you on what to do with the results of that PSA, should it be elevated? So this is really one of these joint decision-making, shared decision-making issues that come up in medicine. But the most important thing is to realize that we're all vulnerable, that we all need to take care of our own health, and we should go in to be able to evaluate whether you need a test and then what's going to be done if that test shows that you're elevated. You really want to be catching it early. So this is all about prevention. And so what we're here to highlight today and to remind people about is that we have tools at our disposal. Use them and go seek out the care, because you can't take care of anybody else unless you're taking care of yourself first.
I lost my father to prostate cancer over a decade ago. He was a doctor and a surgeon, and he too often ignored his own health because he was too busy. Screenings and tests and treatments would take him away from the important job of caring for his patients. So I urge all the men to take care of themselves, to get the appropriate screenings, and take the time to get the right treatments for your body to keep yourself healthy and strong for your loved ones.
I think the message, though, beyond prostate cancer and specifically, is the importance of preventive care, the importance of access to regular physicals and access to healthcare providers. So when it comes to things like workforce development and all those things that may not seem as directly connected to men's healthcare, we're going to continue to work on those. But I'm very much open to the conversation, and I think we do need to do what we can to help men be able to share these experiences and to know what steps they need to take to remain healthy.
My journey started when my insurance basically pretty much forced me to go and get one more screening test that I had done 2 years earlier. But I am going to credit the medical teams, my doctors, and the science for actually probably saving my life.